Okay.
Good morning, everyone. This is Connie Hayworth, the Executive Director at St. Anthony's Senior Living. Thank you so much for joining us this morning. This show is called The Joy of Aging, because at St. Anthony's, we do believe that aging is something to celebrate. And my guest today is Lori Morgan. Lori is a board-certified geriatric pharmacist. Did I get that right?
Yes, you did. Thank you, Connie.
Okay. She's with Guardian Pharmacy, which is our preferred pharmacy. And I want to welcome you, Lori. Thank you so much for being with us. People have so many questions about the COVID vaccine.
Thank you so much for inviting me to join you today.
So I guess the first thing I would ask Lori is, how is a vaccine developed and tested?
Okay, very good question. I know we're all concerned about that. So the approval of a vaccine for use in people involves multiple phases with different goals for assessing effectiveness and safety in different populations. There are a total of 4 phases, and the vaccine must meet very intense safety criteria before completing each phase. Once a vaccine is approved for use after phase 3, it has been tested in tens of thousands of people, and if no significant harmful side effects are noted, it is then considered safe for use. Phase 4 involves continued monitoring and gathering of safety data. This type of clinical trial has been used for decades to approve medications and vaccines.
So I know my father, he takes home the paperwork from every prescription, gets that big thing out and reads every side effect. And, in the reporting on these vaccines, they've got to report everything, right? I mean, they've got to report any sort of response that happened, so that if that happens to someone else, that they're aware that that could be a risk factor, but doesn't mean you're going to get all of those things. Is that correct?
That's very correct. So safety is the most important requirement for the vaccine, and it is assessed in trials by independent experts. Most adverse side effects will occur within 6 weeks of a vaccine's administration. The FDA has required 8 weeks of safety monitoring so it can track any side effects. The FDA advises a minimum of 3,000 participants to assess this safety. The current phase 3 trials have 30 to 50,000 participants. This really demonstrates how safety is a top priority for the FDA and our medical community.
I actually have some friends who volunteered and participated in some of those trials. So,
oh, that's amazing.
Yeah, they were very dedicated to helping, find a solution. So now, the COVID-19 vaccine is a messenger DNA or an mRNA vaccine. How does that work? How does a messenger DNA vaccine work?
Okay, so that is a very good question as well. And you can look on the CDC website, and there it talks about how messenger RNA vaccine contains material from the SARS-CoV-2 virus that causes COVID-19. This material gives our cells instructions for how to make a harmless protein that is unique to the virus. This protein cannot build a virus or cause infection. After our cells make copies of the protein, we're used to hearing these as antibodies, they destroy the genetic material from that vaccine. Our bodies will then recognize that protein, and it will be there to build antibodies that will remember how to fight the virus that causes COVID-19 if we're infected in the future. While messenger RNA technology is new in vaccine development, this technology is being successfully used in cancer treatments, and it has been used for at least 10 years in that area.
Wonderful. Well, so it's basically causing us to develop antibodies by putting this little bit of
tiny
DNA.
piece. They're calling it like a spike. If we've all seen pictures of COVID, it's all got these little spikes. It's like a spike piece.
Great. Well, how long will it take after the vaccine to be protected against COVID?
Okay, and that is the next question for all of us. So even when we receive the vaccine, we will not be immediately protected, and we're going to need to continue wearing masks, social distancing, and practicing hand hygiene. The vaccines that are coming out now, Pfizer and Moderna, require 2 shots. They're given a few weeks, like 3 to 4 weeks between each shot, and protection will usually occur about 2 weeks after the second shot. So while no vaccine is 100% effective, these vaccines are running around 95% effective, which is awesome.
Yeah, that's a really, really high percent. I know. I was reading some other information where it was 70% or something like that. So a 95% efficacy, that's incredible.
Yes. Well, you know, flu vaccines, sometimes we've had years where they were only 30 to 35%.
Well, and I think a lot of people are thinking about the flu vaccine, and, you know, this is a totally different science than the flu vaccine. It's a totally different, you know, situation with this, with the our mRNA. It's a totally different type of vaccine. So what about like someone who had COVID or they got tested and they have antibodies? Do they need to take the vaccine anyway?
So again, great question. Yes, even if you have had COVID-19, it is safe to get the vaccine, and this will give you additional protection without causing any harm. If you have had a test that shows you have COVID-19 antibodies, you still need to get the vaccine. It is safe and increases your protection from future COVID-19 infections. So you're also protecting your loved ones and those around you.
Right, because it's not always just about us, it's about the people we're around. So,
Yes.
you know, we've all had to make a lot of tough choices during the holidays about seeing family. And
Yes.
so having the vaccine will also help us protect the people that are around us. What are some of the possible side effects, Lori?
So, you know, the vaccine's currently being tested. So this is especially the Pfizer and Moderna that are coming out that we're going to be seeing. They do cause some short-term discomfort, such as vaccines that we've had. So we have the headache, muscle pain, fatigue, chills, fever, and some injection site pain. And a percentage of the people who receive them, you know, they will see this. This is the effect of your body developing immunity. So it's showing that it's working. Clinical trial participants reported that the discomfort went away after a day, sometimes sooner. When you receive the second dose of the vaccine, the discomfort can be greater. This is a normal reaction, and so we need to be prepared for that. If you experience discomfort after the first dose of the vaccine, it is very, very important that you still receive the second dose, which will be a few weeks later, because you need that for the vaccine to be effective. If you do have this discomfort, it doesn't mean that you have gotten COVID-19. This just means that the vaccine is causing your body's immune system to react and create antibodies, which is what we want it to do. So, you know, if you feel that discomfort, the vaccine is doing its job. In some cases, a person may already be infected with COVID-19 when they get the vaccine, but are asymptomatic or pre-symptomatic. If they later have symptoms of COVID-19 or test positive, that does not mean that you got COVID-19 from the vaccine. So again, similar, if you think about the flu shot, the flu vaccine, people will say, I have the flu because I got the flu shot. Well, the vaccines are not immediately effective. None of them are, you know, so you have a window where you could catch what you had, but it is not from the vaccine.
Sure. So don't just get the vaccine and throw your mask away and
Right.
around and hug everybody. Give it a little time.
Right, exactly. We will need to continue to be careful.
Right. Now, there are some people maybe that feel like they are on medications, or because of their diagnosis, you know, their conditions, they maybe shouldn't get the COVID vaccine. What would you recommend, Lori?
So if you have any concerns, you know, definitely talk to your own provider, your physician, and you can have the discussion, you know, with your pharmacist, and, you know, they're prior to, like, if you have a vaccine clinic, so you can have all those questions answered. There may be a few people that if they're on chemotherapy treatment or something like that, where it may not be a good choice for them.
Sure.
If you are sick that day, they will want you to, wait a day or two before you get the vaccination. So there's definitely rules in place, which are similar for all vaccines.
Sure. Well, that's great advice. I saw my doctor yesterday for a checkup and I said, "Are you taking the vaccine, Dr. Allen?" And he said, "I am." I said, "Then I am too. We're in it together." So
Yes.
I figure if it's safe enough for him, it's safe enough for me, right?
Yes. I'll be getting the vaccine next week. So, we all want to get back to normal and be able to see our loved ones and put this behind us.
I know I would. It's been such a year. Well, Lori, is there anything else that you would like to share with us?
I think just, being aware that you might not feel good the first day when you get the vaccine. And the second vaccine might cause a little bit more of the headache and things, but that is normal. It means that it's working. And we need to support each other and, be aware of that when we schedule our vaccinations. But we all need to get through this and continue to mask and socially distance and wash our hands. And, hopefully in the months ahead, this will be behind us.
Well, I hope so too. And we're all in this together. And it's going to take all of us to get, to make things better. I am in one of our model apartments. I didn't even mention that. So that's why I don't have a mask on. No one is in here with me. So
I'm alone too.
yes, socially distant.
Yes.
Anyway, Lori, thank you so much. You answered so many questions and I really appreciate you making time to be with us today. And I want to thank everybody that tuned in. Have a blessed day and we will see you soon.
Thank you very much. Bye-bye.
Thank you.